against HIV. Now, the report titled United to End AIDS says that the global HIV response has reached a critical moment where reductions in funding already affecting HIV prevention, testing, and community-based services in countries carrying some of the highest burden of the virus. Now, according to UNAIDS, external financial support for international development, including global health programs, fell by 23% in the year 2025 compared to the previous years. Now, the organization wants that these funding reductions have a direct impact on essential HIV services, particularly in the low and middle income countries that have traditionally depended on international support. Now, between 2024 and 2025, HIV testing programs reportedly declined by 22% in areas heavily affected by the virus. Funding for condoms was also reduced by more than 90% in some programs, and raising concerns that fewer people may have access to one of the most widely available methods for preventing HIV and other sexually transmitted infections. Now, the report also reviews a significant decline in access to pre-exposure prophylaxis, commonly known as PrEP, which is used by HIV-negative people to reduce their risk of acquiring HIV. Now, across the 62 countries, uptake of PrEP reportedly declined by 38% between 2024 and 2025. Now, this organization wants that the disruptions to prevention services could lead to an increase in the new HIV infections, particularly among populations already facing the barriers to health care. Now, despite these challenges, progress towards the global 95-95-95 targets have largely been maintained. And these targets aim to ensure that 95% of the people living with HIV know their status, and 95% of those diagnosed receive antiretroviral treatment, and 95% of people receiving treatment achieve viral suppression. However, the report highlights major inequalities that continue to affect different populations. And in Sub-Saharan Africa, women report disproportionately affected by HIV, accounting for approximately 6 out of every 10 new HIV infections. Now, children living with HIV also continue to fall behind adults in access to diagnosis and treatment. And in the year 2025, about only 54% of children aged 0 to 14 years living with HIV were receiving antiviral viral therapy, meaning many children remain without the life-saving treatment they need. Now, this organization also reports that certain populations continue to experience disproportionately high rates of new HIV infections compared to the general population. Now, the organization says that these inequalities are often worsened by stigma, discrimination, and other barriers that affect and prevent people from accessing testing, prevention, and treatment services. So, despite the current challenges, the organization maintains that ending AIDS as a public health threat by the year 2030 remains possible, but once that countries must act urgently to protect the progress already achieved. Now, the report calls for countries to take a greater ownership of their national HIV responses by increasing domestic investment and reducing excessive dependency on external funding. Now, UNAIDS is also calling for a diversified financing, stronger community-led programs, and integration of HIV prevention and treatment services into the universal health coverages. So the organization says that the global HIV response can still recover from the current setbacks, but governments, communities, and international partners must work together to ensure that funding cuts do not reverse decades of progress. Now, the organization wants that the choices made now will determine whether the world will remain on course to the end of AIDS as a public threat by the year 2030, or risks allowing new infections and preventable deaths to rise again. Now, moving on to our next story for today. Now, Buganda Kingdom joins the Ministry of Health Uganda as mosquito net distribution sets to begin in August. Now, the Ministry of Health has strengthened its partnership with the Buganda Kingdom as preparations intensify for the distribution of the mosquito nets across the Buganda region, with the exercise expected to begin in August. Now, the Deputy Katikkiro of Uganda, Owekitiibwa Robert Wangwa Sibibwa, officially launched the regional distribution initiative and pledged that the Buganda Kingdom will fully support in ensuring that mosquito nets reach communities and are properly used to prevent malaria. Now, the symbolic launch was attended by a delegation from the Ministry of Health, led by the Commissioner for Health Promotion, Education and Communication, Dr. Richard Kabanda, together with the Deputy Programs Manager for Malaria, Dr. Catherine Maiteki Sebuguzi, and other health officials. So during the launch, Wagwa and Sibibwa said that the Buganda Kingdom would use its extensive leadership and community structures to sensitize the public about the importance of constantly sleeping under insecticide-treated mosquito nets. Particularly, particular attention will be given to areas where mosquito nets utilization remains low, including the southern parts of Buganda, Wakiso, and Kampala. Health officials said that distributing mosquito nets alone is not enough to reduce the malaria cases if families do not use them correctly and consistently. So the Buganda Kingdom is therefore expected to mobilize communities through its local structures and leaders to encourage households to properly use and care for the nets they receive. Now, the distribution in Buganda forms part of Uganda's nationwide mosquito net campaign, under which the Ministry of Health plans to distribute approximately 25.8 million long-lasting insecticide-treated mosquito nets across the 130 districts. So the nationwide campaign is being implemented in phases, targeting the millions of Ugandans as part of efforts to reduce malaria infections and deaths. So according to the Ministry of Health, the current national campaign is aligned with Uganda's malaria elimination strategy and aims to increase access to the proven malaria prevention interventions. So the partnership with the Buganda Kingdom is expected to strengthen community mobilization, particularly in densely populated areas where malaria prevention remains a major public health priority. So malaria continues to be one of Uganda's most serious public health challenges, particularly affecting children under 5 years of age and pregnant women and communities living in areas with high malaria transmission. So the Ministry of Health has emphasized that mosquito nets should be used every night and should not be kept unused, sold or diverted for other purposes. Health authorities are also encouraging Ugandans to contribute highly to the use of these treated insecticide nets with other malaria prevention measures, including elimination of mosquito breeding sites around homes, seeking early testing and when symptoms develop, and completing prescribed treatment. Now, the Ministry of Health says that ultimate objective is not simply to distribute the millions of nets, but to ensure that they are properly used to protect families and contribute to Uganda's goal of reducing malaria-related illnesses and deaths. Now, from that story, moving on to the second last story for today. So, Arua Ebola Prevention System praised as the Health Ministry studies border districts' best practices. Now, the Ministry of Health has praised the Arua district for maintaining strong Ebola preparedness and surveillance system despite of its proximity to the Democratic Republic of Congo, where the ongoing Ebola outbreak continues to pose a cross-border public health threat. Now, the Ministry of Health state in charge of primary health care, Dr. Charles Ayume, led a team to the technical offices and visiting delegation to Arua to study the systems and practices that have strengthened the district's ability to detect and respond to the imported Ebola cases. Now, Arua is considered strategically important in Uganda's disease surveillance system because of its location in the West Nile region and movement of people between Uganda and Democratic Republic of Congo. And during the visit, the delegation assessed the Regional Emergency Operations Center, which plays an important role in coordinating preparedness and response activities during public health emergencies. So the delegation also visited Alua's airstrip and Avura point of entry, where systems have been established to strengthen health surveillance among travelers. So points of entry are particularly important during disease surveillance and outbreaks because cross-border movement can allow infectious diseases to spread from one country to another. So the Ministry of Health has therefore continued to strengthen surveillance, screening and preparedness in border districts as part of Uganda's wider response on the ongoing Ebola threat. So, Uganda has been strengthening regional laboratory capacity as part of its efforts to improve the spread at which suspected Ebola cases and other infectious diseases can be investigated. So, health authorities say that early detection is one of the most important elements of controlling Ebola because suspected cases must be identified, isolated, and investigated quickly to prevent further transmission. So the current outbreak affecting the DRC and Uganda is currently caused by the Bundibugyo species of Ebola virus. And the World Health Organization declared a multi-country outbreak a public health emergency for international concern in May 2026. And this has placed additional pressure on Uganda's border districts to strengthen surveillance, contact tracing, laboratory preparedness, infection prevention, and community awareness. So as Uganda continues to strengthen its Ebola response, health authorities are emphasizing that preparedness must extend beyond treatment centers, and the Ministry of Health says that the system observed in Arua provide an important example on how coordinated preparedness can strengthen Uganda's ability to detect and respond to the public health threats before they spread widely. Now, moving on to our last story for today, the World Health Organization updates HIV medicine dosing guidance for the newborns, infants, and children. So the World Health Organization has issued a new guidance on how their antiviral medicines should be given to the newborn babies, infants, and children in a move aimed at improving HIV prevention and treatment for some of the youngest and most vulnerable patients. So the new guidance provides health workers with updated information on the correct doses of antiretroviral medicines for children according to their weight, age, and specific medical circumstances. So unlike adults, children cannot simply be given smaller versions of adult doses, so the amount of medicine a child requires can change as the child grows, gains weight, and also develops. So WHO says that the updated guidance is based on the latest specific evidence, including clinical studies, research on how medicines are absorbed and processed by the body, and also expert recommendations. So the guidance includes updated dosing recommendations for some commonly used pediatric HIV medicines, including the combination of these viruses. So WHO has also provided detailed dosing tablets covering different pediatric formulations, giving health workers practical guidance that can be used to different levels of health care. Now, premature infants may process medicines differently because their organs and body systems are still developing. WHO says that the updated guidance provides more specific conditions to help health workers safely manage HIV prevention and treatment in these babies. So that the guidance also marks an important distinction between the medicines given to prevent HIV infection and those given to treat children who are already living with HIV. So babies born to mothers living with HIV may receive antiretroviral medicines after birth to reduce the risk of acquiring the virus. And children who have confirmed to be living with HIV, however, require a full treatment of this dosage to control the virus and protect their immune systems. So, globally, children continue to lag behind adults in access to HIV diagnosis and treatment. So this means that strengthening early infant diagnosis, ensuring uninterrupted access to appropriate medicines, and helping caregivers correctly administer treatment remain critical. So the new WHO recommendations are intended as part of practical resource for clinicians, program managers, and policymakers responsible for HIV prevention and treatment services. So WHO says that it will work with the countries and partners to support the implementation of this updated guidance and improve access to the appropriate antiretroviral formulations for children. So this organization has also identified areas where more research is still needed, particularly in the development of the medicines that are easier and safer to administer to newborns and young children. So health experts continue to emphasize that with early diagnosis, the correct treatment and consistent adherence to the medication, children living with HIV can grow, develop, and live a healthier lives. And WHO says that its ultimate goal is to ensure that every child from birth through adolescence has equitable access to effective HIV prevention and treatment as the world works towards ending the AIDS as a public health threat by the year 2030. Now, to our dear viewers, that brings us to the end of today's health updates on Your Health program. So from protecting your communities against malaria and Ebola to improving HIV care for children to strengthening the global efforts against HIV and AIDS, today's stories highlight the importance of prevention, early action, and strong health systems. Remember that your health begins with the choices you make every day and using available preventative services, seeking medical care early, and following guidance from the health professionals. So thank you for joining Your Health Updates. I am Kaitis Elizabeth. We are going to come back with an expert discussion today, which is highly important for you and your families, plus your loved ones. Before we head there, let's take a short break and then we come back.